extending the neck of the patient with no pillow behind though, and scanning the thyroid gland with 3.5 megahertz probe. First in transfer section. In this way I will move the probe in this direction and then 90 degrees from here in this direction and then 90 degrees in this direction to get the thyroid globe in longitudinal section. This will give me the transfer section. This approach and just at the trachea. Now I will magnify the image. See now, let's do it on the ultrasound machine. See it on the ultrasound machine. Always magnify the image to the maximum where you can see the thyroid gland in total. Now this is the transfer section of the thyroid gland, and if you see that this is the left lobe of the thyroid, which is normal. I'm moving the probe downwards. Now, this is the isthmus. This is the tracheal air shadow. This is the tracheal air shadow, and this is the left thyroid lobe. This is the left thyroid lobe in transfer section. This is the common carotid artery in transfer section, internal jugular vein in transfer section, and this is the left thyroid lobe in transfer section, which is normal. Now, getting the transverse and then rotating it 90 degree, I get the longitudinal of the left thyroid lobe, which measures 5.7 centimeters in length and 1.68 centimeters in anterior-posterior diameter. This is the left lobe of the thyroid in longitudinal section. This is the common carotid artery as its landmark. So this is how we see the landmark is definitely the longitudinal section of the common carotid artery. Now this is the thyroid lobe, left thyroid lobe in longitudinal section. Having done this, now I'm going to move to the left side, and I have an impression that there is a mass, thick wall. This is the wall of the mass that measures approximately 3.1 centimeters by 4.2 centimeters, has multiple echogenicities within it. All these 1, 2, 3, 4, 5, 6, 7, these are consistent with calcification, has cystic areas as well. This is the cystic area. Now this is the transfer section of this solid complex mass, cystic as well as solid, with calcification interspread within it. Now I'm going to get the longitudinal section of the right lobe of the thyroid. Now to see that this is the right lobe of the thyroid, and here you see the landmark, the common carotid artery seen coursing posteriorly. Now this is the normal thyroid tissue. This area shows normal right thyroid tissue. This is the normal tissue, whereas this is the mass in the right thyroid lobe. This is the mass in the right thyroid lobe. It is echogenic with interspread cystic areas and the multiple internal tiny calcified areas. This is the common carotid artery in a longitudinal section, which is the landmark for the identification of the thyroid gland. This is the normal thyroid tissue that is preserved. Now, see that? Compromising upon the landmarks. If I try to get the thyroid in longitudinal section, then see how many calcifications are almost eggshell, I will say eggshell rim is present around this mass. This is the eggshell sort of there are internal, peripheral, multiple, uncountable shadowing and non-shadowing echogenicities. As you see, this is the largest one, weighing approximately 6.1 and giving posterior shadow, as this is a cystic area within. Now this is the preserved thyroid gland. The lateral 1/3 of the gland is preserved. This area of the right thyroid gland is preserved as normal low-level coarse echogenicity, and this is the focal mass, echogenic with internal calcifications. These are all calcifications, marginal, shadowing and non-shadowing both. At the medial, it starts from the medial edge of the right thyroid lobe, extends up to the 2/3 of the right thyroid lobe. So this is a thyroid mass with calcifications, internal, peripheral, multiple, uncountable, preserving the lateral 1/3 of the right thyroid gland. Left thyroid gland, this one is normal. This is the left thyroid gland. This area. This is the left thyroid gland in transverse section. This is the longitudinal section of the left thyroid gland. So the left is normal and the right area